So, Bob, I have a bunch of news stories here that I thought we would read and comment on in a educational yet humorous and conversational way. What do you say, Bob?
I say that when we do this, we find ourselves in all kinds of weird places.
Yeah. This is the Psychology in Seattle podcast. I'm your host, Dr. Kirk. I'm a therapist and a professor. Who are you, Bob?
I am your old friend from graduate school, also a therapist here in town in Seattle.
Yeah, and you have some open spots available in your practice, right?
I do, yeah.
So if you want to hire Bob, you can email him at bob@bobgettle.com.
Yeah.
Or go to bobgettle.com.
Yeah. And
Okay.
feel free to phone too. I actually answer the phone and return calls promptly. Even though, have you noticed a lot of people in our profession do not do that?
Yeah, I do too. It's just something, I hate thinking about someone out there waiting for me to call them back.
I know. It's terrible.
Yeah. But yeah, a lot of therapists, it'll just be like 2 weeks later, and it's like, it's not hard to, respond.
Yeah.
Okay, so this article is titled, Why God Isn't My Therapist. And just to read, written by Jola Szymanska on the website Aletia. There's a quote here. Looking down. These readers wanted to emphasize that faith in God, or the fact of having a relationship with Him, and taking care of that faith through retreats or the rosary, are enough for us not to have any emotional difficulties or problems. First of all, if that were so, no believing Christian... So basically what this person is writing about is they've run into some people who are, some Christians who are saying, I don't need therapy, I have God.
Oh.
And what this person is saying is that is not an accurate way to think. And they say, first of all, if that were so, no believing Christian would suffer from depression, and they would quickly bounce back from feeling down.
Well, that's a little one-dimensional.
Yeah, what do you mean?
I mean, I don't think anybody that's sort of. I think that pain is part of being alive, and people get depressed, and having a faith in God is not going to necessarily mean that I don't expect ever to have pain or suffering. I mean, come on, man. So right. I think her assertion that is sort of apples and oranges.
Right. I think that there are a number of different camps worth delineating. Like, there's certainly a camp of people, and Scientologists are this way too, who are so, indoctrinated into their religion or way of thinking that they're threatened by dogma.
Yeah, right.
Mental health is considered to be evil, or at the very least not valid, or
perhaps in opposition to faith.
Right.
Yeah.
That they perceive somehow.
Yeah.
If you go to a therapist, you're being oppositional to your faith. Right.
Right.
My dog is freaking out about something. Probably someone delivering something, is my guess. So, her name's Chloe, the dog, right?
Yeah.
Did you ever watch Smallville?
No, I never did.
Oh. Did you hear about that new, or that big controversy with that multi-level marketing thing, Nexium, where Keith Raniere and Allison Mack... blah, blah, blah.
Oh, I did hear about that. Oh that was a craziness.
With the branding and the sex cult and all that stuff.
Oh, yeah. Yeesh.
Well,
she was like recruiting or something?
Yeah. Recruiting other young women into this sex cult that was basically blackmailing these young women to stay in this sex cult and having sex with this sex cult leader.
Ugh.
Well, Allison Mack, she's famous for being on Smallville and playing this character named Chloe.
Oh.
And Chloe is named after that character.
Oh.
So hopefully my dog Chloe isn't involved in a sex slave scandal anytime soon.
Your dog Chloe's really cool.
Well, that's what they all say about sex cult leaders.
And recruiters.
Yeah. So she's still barking. Hopefully someone will attend to that. But so there are some people who, and I think what this author is writing against is just like, if you believe your faith is going to solve your schizophrenia or your major depression or your panic disorder or something, you're probably deluding yourself, or that just praying to God that your marriage isn't going to fall apart, isn't probably, going to work.
By itself is not sufficient.
Right?
Yeah.
And so
how can, look, I get the thing about schizophrenia. It ain't going to cure schizophrenia.
Right.
But how do I know that prayer for some marriages isn't going to be enough? And look, this is me talking. I'm not, nobody would accuse me, nobody would say about me that I was spiritually oriented. I'm an atheist. At the same time, though, I do not like it when people disparage people of faith. I think that's just bad manners at the least.
Right. And often it's the foundation of that is that they don't understand people with religion.
Yeah.
They have a characterization, a straw man of what it is to be religious.
Straw man. That is a good phrase for it.
Yeah. And so, yeah.
So while I would say, there's good reason to seek marital treatment if you're having marital distress, I don't know that for some marriages prayer would not be sufficient, and I would be loath to make any kind of generalization that that's not going to do it. For somebody, it's probably out there doing it right now.
Right.
For somebody.
Right. So prayer, the action of prayer can be as many things.
Yeah.
One is that it could just be asking for a supernatural intervention. You know? Please God, make my husband love me.
Right.
But it can also be like a conversation with God. Like, I'm really struggling. God, please help me. Give me the strength to get through this. As you're talking to God, you just get this impression that God's telling you, you should probably get help, or you should probably tell your husband how you feel or something. Right. And you're just like, okay, I'm gonna be a better person.
Right.
Or as you're praying, you just get this sense like, now that I've got this off my chest, I think I've been neglecting my kids throughout this process. Maybe I need to rededicate myself to being, with the strength of God, to be a better parent today or something. Yeah. Those are, legit outcomes, positive outcomes from purely praying. Right? Yeah. So there's that group of people that might just be like, religion will save me. All I have to do is ask God to take away my schizophrenia.
Okay, I get it.
And so that, you can criticize. But there's a whole group of other people who will say, I don't need therapy, I have God. Yeah. One, because they might not have problems that need a therapist.
Well, great point.
Yeah. And when they say I have God, that means a lot more than what people might think it means. Yeah. It mean to a lot of people who have a very strong faith and a strong practice, what it means is praying all the time. It means going to church all the time. It means communing all the time. It means emotionally expressing yourself. It means, giving of yourself to other people, putting things in perspective, and not letting things get to you. There's this phrase of like, I'm going to give it to God. Yeah. I give this to God. And atheists, some will laugh at that and say, look, well, that's dumb. Yeah. But the action of saying, it'd be the same thing for a Buddhist to say, like, I'm releasing attachment to that. Right. Because I don't have control over that. Yeah. And so I'm only causing suffering by being attached to that. And so Christians they'll do that too. They'll just be like, I hand this to God because I don't have any control over that.
Maybe it's another way to express an attitude of acceptance.
Right, exactly. Yeah. And it's a form of self-therapy.
I dig acceptance.
Yeah. Right. So I don't know. I think that it's a complicated thing. And
I like how you put it though.
Psychology Today, article written by Michael Schieringa. How come these people don't have easier names for me to pronounce? Michael S.
It's a conspiracy.
Yeah. Looks like a psychiatrist. Writes a article called The Dark Pool of Psychotherapy. Have you heard of that phrase before?
No.
Yeah. I don't know if this person invented it, but essentially what he's referring to is like that when parents take their kids into therapy and the therapist doesn't communicate with the parents at all. Oh. It's this dark pool of therapy. So he writes here, in this book that he's reviewing, the author described a case of a mother who was, in the author's opinion, overprotective. This mother was unhappy that she was not being told by the therapist what was going on during the therapy sessions with her young son. Mm-hmm. The mother finally confronted the therapist, quote, "This is what I mean. You never say anything specific. What is he saying? What kind of play is he doing? What does he scream? Why does he scream in your office?"
Oh, my.
Unquote. The author of the book portrayed this mother as unenlightened, demanding, and unreasonable. I interpret this as the correct concerns of a reasonable parent. This mother's experience is not uncommon. I hear often from parents about therapists who are not transparent with them about their children's psychotherapy. What do you think about this, Bob?
I think that, boy, what do I think about that? It makes me really uncomfortable. I wonder, though, I want to know what you think. I wonder if maybe when therapists are, not transparent, if it's because they're uncomfortable with their own either practice or skill set, or they're anxious about their own performance. Is that an okay way to put it? I don't know.
Yeah, absolutely. That's exactly, Mike. So you're kind of deferring to me because you've never treated kids.
I don't treat kids. Well, once for a very brief time, and I wasn't any good at it.
Okay. Whereas in my early career, a third to a half of the clients that I saw were children and teenagers and their parents.
Right.
And so, yeah, and all of my supervisees, or most of my supervisees, are seeing kids now. Mm-hmm. Yeah, and I hadn't really come to that realization until recently. Mm-hmm. So for those of you out there that don't know, here's just a brief history on this whole thing. Psychotherapy originally was an individual practice,
right,
and was something that was you separated the individual from the world and from their family system, and you fixed them, and you sent them back into the world, having been fixed. Similar to someone breaks an arm, you don't need to talk to the mom. You just bring in the kid, you fix the arm, you send him back into the world. That was this model
right.
that we had for many, many years. And then family therapy comes along in the 70s and 80s, becomes popular. And they're like, that doesn't work. You can fix a kid, you send him back, but the symptoms come back. That's what they started to observe. And what they started to propose is that a lot of issues need to be treated by the whole family. You have to look at everybody.
They're interrelational.
Right.
Yeah.
In fact, the person who has the quote unquote problems often is just expressing a family problem.
Yeah, right.
So there's that. But even though there were those astute observations and research to back this up, I mean, they've done outcome studies on various different presenting problems, addiction or conduct disorder or other kinds of things, maybe even depression. Schizophrenia, I think, as well. I mean, it doesn't cure schizophrenia, but the symptoms are less severe if the whole family is involved in the treatment. Makes sense, right?
Makes sense.
Yeah. Even though that was all happening, people continued to do this model for a number of reasons. One, I think, because it's so much easier. I mean, as a therapist, if you just talk with a 7-year-old or play games with a 7-year-old in your office, there's a very low chance of anything really annoying happening. Mm-hmm. You bring in the parents now, especially if it's parents and kid in the office with you, the chaos in the session is 10 times higher. There's so many more things that are out of your control, so many more things that are happening that you feel compelled to comment on or control or do something about. And there are times when there are direct opposite goals in life. The parent is like, I want my 14-year-old to do better in school. And the kid is like, I don't want to do better in school. So as a therapist, you're like, which goal do I go with?
Yeah, right.
If the kid's just in the room and says, my mom is pressuring me to do well in school, then it's tempting to be like, okay, well, I can just help the kid deal with or accept or learn how to communicate back or assert themselves back to their parents. If the parents come in and say, I need to get my kid to do better in school, then you talk with the parent about how to, but if they're both in the room, which conversation do you have?
Yeah, right.
And it gets very complicated. And so a lot of people avoid it. Even family therapists, by the way, will avoid it because it's scary.
Scary.
So there's a lot of people still right now who will do that. They'll just take the kid into the room, and they have this practice, which is kind of like the dominant practice in my anecdotal experience, where they won't talk to the parents.
Yeah.
They actually won't want to talk to the parents. And they also, for some people, they consider the parents kind of a nuisance.
Yeah.
Like if you're asking about what's happening at therapy office, you're being overprotective as
You're
this person.
invading.
Yeah. You're anxiously enmeshing, you know,
Right.
like you need to learn how to individuate, you know.
Pathologizing. Oh my God.
Right?
Yeah.
Yeah. You need to learn how to essentially not love your child, you know, not be concerned about your child. So, there's nothing wrong. There are certain times when that's not a bad model. If a child is, for example, in an abusive relationship with their parents, like you want a place for the kid to be fully safe. And not have, especially if the kid is like, I love therapy. I feel safe here. I'm so glad I'm talking to you. I do not want you talking to my parents. You know, and I've had kids say that to me. They'll just be like, don't talk to my parents. And I'll be like, well, why? They're like, well, because I need this. Like, this is the one place I can go where I know you're not going to go to my parents. And even if I'm like, well, what if I agree I won't say anything that will compromise you? Like, still, they're in every other aspect of my life. I don't want them in this aspect. Then I'll be okay. You know, it's fine. So there's some times when I myself, and I think it's justified and clinically helpful to just tell the parents, I can't even talk to you. Like I'm not even going to talk to you about anything. Now, if the kid is below 12 and below, then the parents have full access to everything, which is also kind of another thing. It's just like, that's another thing that a lot of parents don't know necessarily, and a lot of therapists don't necessarily follow.
Yeah.
But even then, if you had a 7-year-old where you're working on something really specific and you're just like, I need full independence here, and I can't really, involve the parents. Okay. Those are rare situations.
Yeah.
The vast majority of situations, from my experience, involving the parents is not only fine, but it enhances everything. My ability to go to the parents and say, like, your daughter, Jenny, is really struggling with her self-esteem. She doesn't exhibit that. What she exhibits at home is a lot of attitude. But really, my interpretation of that is she's very sad and very insecure, and she feels very shameful about herself in general.
Yeah.
And when she rolls her eyes at you and won't talk to you, and then you get angry at her, it just compounds the whole thing and pushes her away and makes her feel even more shameful. She's 14. She's a child. She doesn't know how to communicate her feelings. And so let's put that in perspective. So the next time you see her roll her eyes, interpret that as a insecure child being insecure and being shameful, not as a defiant person who needs to be told that they're a piece of shit. Do you know what I mean? Or given the impression that they're a piece of shit. And so I've had countless conversations with parents along those lines, helping them to understand their child so that they can have I'm not telling the parents to back off. What I'm telling them is like, let me help you interpret your child's behavior so that we don't get into these weird loops where the kid rolls their eyes, you yell at them, they feel even worse about themselves, which causes them to feel like they need to roll their eyes more, and it just goes round and round and round.
Yeah.
So, and I can do that in 5 minutes with the parents at the beginning of the session. The parents come in, I talk with them, the parents leave, the kid comes in, and I have the rest of the session with the kid. I don't even have to really interfere that much with the individual therapy for the kid. And so when I talk to my supervisees, they will sometimes say stuff like, so I have this really annoying parent, that just keeps asking me these questions. And it's just like, lay off, like, let me do my job. And I'm like, whoa, wait a second. As you were saying, it's like the clinician, they're exhibiting a fear of that they're afraid they're not going to be able to justify what they're doing. And that fear is justified because there's no class that a graduate student takes that involves a module on how to convince a parent that therapy is worth it for their kid.
Yeah.
But doesn't that seem like an obvious thing that should be taught to young therapists?
Oh, yeah.
Especially ones that work with kids?
Yeah, absolutely.
Like, how do you explain to a parent that the therapy you're doing, what it's doing and why it's doing and how it's going to benefit the child and the family? That's a very complicated thing, actually. One, because the conceptualization that underlies that conversation is actually quite advanced. Like the ability to say, I am playing Legos with a 5-year-old boy who has been traumatized. They experienced they saw domestic violence growing up. And so I am playing Legos with him as a way of, so this is me kind of explaining it to a parent. It takes probably, I'm terribly sorry to tell you this, but it probably takes 6 months just for Johnny to feel comfortable with me so that we can begin the work that needs to be done. And it takes about 6 months for me to get to know how he plays in relation to his emotional world. If he were 25, I could ask him how he feels. He's 5. I can't ask him how he feels. It's harder. We can certainly begin the language around emotions, but it's so much more, nuanced with a 5-year-old. He probably doesn't even necessarily know what he feels. And so I have to enter his world through play, and there's going to be 6 months where, it's just the beginning phase, and maybe it'll go faster, maybe it won't, but it's going to take some time. Then once I get to know his emotional play world, and he gets comfortable with me, and we get into a routine, then I'm going to start playing with him, still playing Legos with him or something else, and we're going to start processing his emotions through the play as a proxy to what he actually experienced in real life. Again, if he were 25 or 45, he would just talk about the pain or fear he went through witnessing domestic violence in the home. But with 5-year-olds, typically that's not what can happen. And so the 5-year-old, little Johnny, has to process that through the play, and I have to interpret what he's doing as metabolizing those emotions and getting validation. For example, if he is making something and then I start to play with him, near him, and he puts a boundary up and he says, "No, this is my Lego thing that I'm building. You build something over there." And after 6 months of getting to know his emotional world, I realize right now he's trying to assert power and boundary as a way of testing the world to see if he has the power to create his own safe space. And then in that moment, I intuit that I need to validate that and honor that and give him that space, even if he's being dysfunctional. Maybe he throws something at me and he says, "Get away. This is my corner." If I was a parent, I would say, "Don't throw. You got to play nice. You got to play with me on this." As a therapist, I have learned through emotional, work with him that this is his need. And so through a corrective experience, I allow that to happen. I don't comment on the fact that he threw something at me. I get far away from him. I'm still paying attention to him. And I comment something along the lines of, "I see that you really want your own space, and I honor that. You deserve to have your own space. Sometimes it feels good to have your own space, and I thank you for telling me that you wanted your own space." And I'm guessing that is therapeutic. I'm not sure, because you never know when you're playing with kids. It's hard to say. But when kids are given those therapeutic moments, they start to calm down a little bit. They start to feel more powerful. They start to feel more higher self-esteem, more safety, and therefore less likely to lie, less likely to throw things, less likely to get angry. They get better sleep at night. Everything gets better from that. So that's me explaining, therapy to a parent. What do you think?
I'm playing Legos.
Yeah.
Because if I'm a parent and I don't have any background in this stuff, I just think this highfalutin dude's playing Legos with my kid.
Right.
Well, I could do that.
Right.
Yeah.
It looks like nothing.
Why am I paying for this?
Right. Now, what I find a lot of novice therapists, what they run into is they don't, one, know how to put it into words, but two, they don't even know what they're doing to begin with, because they're so young, they're so novice that they don't even understand the theories behind why they're doing what they're doing, which it is incumbent on me as a supervisor to teach them. And then incumbent on me as a supervisor to teach them how to talk to parents. Because the idea is like when a parent starts to confront you and say, "What are you doing in there?" That is a wonderful opportunity to explain to them what you're doing in there. And if the parent, so, let's say my role played explanation and the parent's like, nah, not for me. Okay.
No.
You're if you fully understand what my approach was and it's not for you, fine.
Yeah.
I would rather know that now
Right.
than avoid you and keep you out of the office and be annoyed by you, because the other thing is parents don't really have a lot of power. It's not like, you go to a McDonald's and you walk up, to the cash register and you're like, so how much does a Big Mac cost? And the cash register person's like, why should I tell you?
Yeah, right.
I don't know. And then you're like, well, what's in a Big Mac? These are a lot of fucking questions.
Yeah.
Well, you very easily have the ability to be like, fuck this shit, I'm going next door to Burger King.
Yeah.
When you go to a therapist and you're like, please explain to me what's happening, it's so hard to find a therapist that has time and is open and nearby your house and is covered by your insurance and, blah, 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 blah,
Yeah.
that it's not really a consumer-driven scenario. Like,
Right.
you're sort of like, well, I guess. And plus, if all the child therapists in your community are doing this, then as a parent, you have no power. You just said, well, I guess I'm just out of the loop.
Right.
I guess this therapist is just going to like not communicate with me. I hope therapy is helping. I have no idea if it is or not, or what this person is doing, but what do I know? They're the doctor. They're supposed to know. I find it to be incredibly unethical, disempowering to people, irresponsible of therapists, and really an outgrowth of bad supervision and bad education.
Yeah.
Probably once, I don't know, every month, I'll do exactly what we're talking about here with my supervisees. I'll role play, how do you tell? Because as I'm role playing how you talk to the parents, they're actually learning theory too. You know what I mean?
Right.
Like the way I talked about 6 months of getting to know their emotional world, and then an anecdote about a corrective experience in play.
Right.
Like they're like, oh, that's what that's what using play in therapy is for. I guess I'm starting to kind of get that.
Right.
Because a lot of young therapists, a lot of novice therapists have a really hard time with that symbolic world. They're much more used to thinking about therapy as a advice-given, skill-based thing,
Language-based.
Right.
Yeah.
Or even more precisely a skill-based thing.
Really?
Yeah. And a lot of these interns, they work at agencies where that is the dominant form. Like you don't create emotional experiences.
Right.
You don't heal people. You give them skills.
Right.
What skill? In fact, there's a lot of practices at these agencies now where they make the therapist type out the note with the client, on the computer at the beginning and at the end.
Oh, how awful.
Right?
I mean, like, it's like you have 4 more people in the room.
Right. And it makes it feel like impersonal.
Oh, totally.
I mean, there's a way to do it to, like in a way that doesn't interfere, I think, but to force all the therapy, because, I was taught like I could do that if I wanted to, but I was also taught like, but if you don't want to, you can do your notes after they leave if you want, it's your option. Anyway. And so when they're doing these computer things, a lot of times the computer things will ask the therapist, what skill did you teach the client today?
Oh man, that's a high demand moment.
Well, and like, that's assuming that that's what the client needs.
Right.
There's so many things like with my example with Johnny at the 5-year-old, the first 6 months, it's just playing, just getting to know the kid. There's no skills. There's no teaching. Plus, what are you going to teach a 5-year-old, really? I mean, there's some emotional regulation skills you could teach a kid for sure.
That undermines a client's faith in the therapist. If the question says, what skill did you teach? And you didn't teach me a skill today, are you any good?
Right.
Because the implication is I'm filling out a form. It must be, have valid basis to it.
Right. It basically forces everyone to really privilege skill teaching at the complete ignorance and discounting of the vast majority of what therapy can do for people.
When we were coming through internship and the young days, was your...
No.
Yeah.
Well, my internship was very, floppy, I would say. It didn't have a lot of because it actually emerged out of a group practice. So it was a group practice in Federal Way of like 5 to 10 therapists. And then they're like, hey, we should create an agency. And then they created an agency, and they continued to see a lot of people for private pay. And they're like, well, people are asking us for medical coupons. So they started to look into that.
Right.
And so I came in at that point.
Okay.
And then, so it was very loose. There wasn't a lot of, our paperwork was very loose.
Yeah.
Our policies were very loose, and so, and my supervisor was extremely hands off. She's just like, well, what do you think is going to help? She was just very encouraging in that way. What about you? I mean, you were at more of a...
I was at a adult outpatient mental health clinic that worked with many folks with chronic mental illness, and then what was that? The population? Essentially, poor people, most of whom had trauma histories and were on public assistance.
What about the formalization of skills and paperwork and all that stuff?
There was paperwork that we could ignore. We still had to fill out. I kept it out of the sessions. I did it on my own. I could just check boxes and fill things in and get it so that it would go away.
And to be clear, this is the mid-'90s when
Yeah.
we didn't have computers at these offices yet.
Oh, yeah, no.
Yeah.
But there was a lot of, since that's all government, state government contracted, whatever, they have their fingers in the pie, and whoever they consult about this stuff has their own ideas about what is good treatment. And, that doesn't have anything to do with the person sitting in front of me necessarily.
Right.
Because there isn't a one size fits
It's
all.
a hoop you jump through to get funding.
It is a hoop you jump through to get funding. And so, you learn to jump through the hoops. And they were behaviorally oriented treatment plans that we all got really good at.
Bullshitting.
Yeah.
I mean, to be clear, it wasn't fraud. It was real, right? But it was just a percentage of emphasis that we had in our sessions.
Small percentage.
All right, let's take a break before someone complains about us to the licensing boards. And we'll when we come back, we'll talk about more things in the news. What do you say, Bob?
Sounds good.
All right, we're back from the break. Again, if you want to hire Bob, a lot of people ask about it. They're just like, man, that guy has a great voice. He seems like an awesome therapist.
Thank you.
Go to bobgettle.com. That's Bob Goettle, GOETTLE.com, and you can hire him if you're in the Seattle area. Next article here is from Todd Essig. What celluloid shrinks tell us about psychotherapy today? So in other words, like therapists who are in TV and movies.
Huh.
And he writes, of course he holds his ground. That's what's expected. But that was then, not now. Contrast that with, so he writes about how there was a movie in the 60s about a therapist who was being pressured to talk about what was going on in his sessions with a particular person. And the therapist held his ground and said, confidentiality, I'm not going to tell you anything. And that was kind of part of the plot.
Who was asking? Do we know?
I don't know.
Okay.
It was in a movie.
Yeah.
The president's analyst, James Coburn, played the president's analyst. So I think the FBI was like asking, but that was in This Is Now. Contrast that with 3 shrink portrayals currently streaming. Doug Stamper's therapist in The Last House of Cards. The solid, do you watch House of Cards?
No.
The solid Aryan Jungian psychoanalyst, Dr. Daniel Ryan, in the 3rd season of The Man in the High Castle. Do you watch that show?
I watched the first season. I didn't watch anything beyond.
And I watched the first episode, and I was like, this looks interesting, but it's not really grabbing me.
Mm-hmm.
And the Julia Roberts character in Homecoming.
I watched that.
Oh, you did?
Yeah.
What'd you think of the Julia Roberts character?
I liked her in some ways.
Yeah.
And in other ways I did not. And
did she portray like a good version of it? You're gonna break the. You're gonna.
I don't want to spoil it.
But does she portray us well?
Better than most. I'll say that.
Okay, well that's good. Each of these 3 therapist counselors were active conduits sharing supposedly private information with agents of political, governmental, or corporate power.
Yeah.
For each of them, the plot hinged on not respecting the confidentiality that used to be at the core of the psychotherapeutic relationship. a lack of privacy now is taken for granted. Expectations for privacy have really changed, mostly because privacy in psychotherapy has really changed. It's being eroded. What do you think about that, Bob?
I'm not aware of that at all.
I anecdotally agree with this. So I will talk. I mean, well, you tell me, Bob.
That's scary.
When we were in graduate school and young therapists, was it understood that confidentiality reigned and there were extremely rare circumstances under which we would actually break that confidentiality?
Yeah, Tarasov.
Yeah.
You don't...
Like, it was really rare. It was like, the assumption is you don't talk to anyone other than your client about any of this stuff.
Well, supervision, consultation groups, that sort of thing. But
mandated reporting,
that
duty to protect, those kinds of things. But I remember really internalizing that notion, but I don't know if I just took to it or what, because now when I talk to students who have taken ethics classes, by the way, and there'll be some scenario like some supervisee will present on a case and they'll be like, so I have this teenage kid and he has a gun hidden in his bedroom. He has a gun. And I'll be like, okay, has he threatened anybody? No. He just says it makes him feel safe. Has he threatened to kill himself? Do you think he's going to kill himself? No, he's not suicidal. Okay. And they're like, so I should call the cops, right? I should tell the parents, right? Or I should tell the teachers, right, that he has a gun. Like, what do you think about that impulse?
Well, legally, I don't. What's the legal age for owning a gun? That's a side issue.
Let's say it's illegal for the child to have the gun.
Well, it's illegal for a kid to have weed too, or booze, and it happens. I think that you make yourself liable if you divulge.
Not only that, but isn't therapy a confidential relationship? Like,
right. Listen to me.
Where in your disclosure statement does it say the relationship is, confidential unless I hear about you having a gun illegally? Like, just because it scares you that a 16-year-old has a gun doesn't indicate, one, that there's danger, and two, that it rises to the level where you have justification for breaking that confidentiality. But I find that a lot of people will be like, but in fact, I bet you anything, there's listeners out there right now, other clinicians even, who are just like, well, aren't you supposed to report like dangerous things? Like, isn't that what you're supposed to do? There are exceptions to the confidentiality for sure that you could make a justification for telling the parents, for example, or even telling the police, if you had enough data that indicated that something really dangerous was going to happen. And the 16-year-old kid probably wouldn't have much power to fight back or even know that he could fight back if he was really upset that you did say anything. But I find it really alarming that a lot of novice therapists, a lot of young people, and really even frankly experienced therapists, they just assume like, well, of course you're going to tell someone about that. Like, there's no debate in their mind. And there's no like awareness of the fact that this is not one of those exceptions. That in fact, there are clear guidelines around like, unless it fits these criteria, then you don't tell other people about it. Again, you probably could, if you could make a report and say like, given his impulsive behavior that he exhibited in other arenas, him having a gun and having emotional issues, even though he hasn't made a threat to other people, and even though he doesn't exhibit any suicidal ideation, it's my professional opinion that this rises enough to a danger to himself and other people that he has a loaded gun in his house. You could probably make that and not be successfully sued by him for having broken that confidentiality. But at the same time, if we're going to help people, they need to fucking trust us.
Yeah.
And if we just turn around and tell on them every time we think they're doing something quote unquote bad, then they're not going to get any help. You're so much more helpful talking to him and being like, so why do you feel like you need a gun? Well, Well, what else is going on in your life? What else are you afraid of? what other kinds of things could you do besides having a gun that would make you feel safer? Maybe advocating for yourself, or I don't know. Maybe it's actually functional to have a gun. A lot of people have guns for functional reasons, so to speak, you know? Are you getting trained in safety around a gun, you know? When you get angry, what do you do? Like let's talk about that. Rather than telling the police your client hates you and never goes to another therapist again for the rest of his life.
Right.
Like, let's look at the pros and cons there. And that's kind of a severe example. Like,
Sure.
like less severe examples would be like, I don't know, a kid talks about having jumped another kid at school.
Right.
Like he and a friend like beat the crap out of another kid at school with their fists.
Mm-hmm.
You know what I mean? That feels like something you're supposed to report. It is not.
It isn't.
You do not report that.
Nope.
Now, again, you probably could make a justification for it. Like
Well, that's the problem with it, though, is that you could make a justification for it, which represents a fundamental misunderstanding of your duty and your
Right.
ethical, mandate.
And the purpose of confidentiality, which is that if someone is troubled and they're doing troubling things, what a wonderful opportunity that person has to be able to talk about all of that with someone who cares and someone who can actually help them without worrying that they're going to get in trouble.
Yeah.
We want that as a society. That's why it exists.
That's why it exists.
You know, there's a tension between that and like, well, we also want justice and we also want
safety.
Freedom of information and safety.
Yeah.
And so we want therapists to be able to tell on their clients, right? But a much bigger want is that these people get the help that they need so they can stop doing these things.
Right.
So
this person in this article is writing that confidentiality is being eroded by this kind of arbitrary self-copying.
Right. So, well, I don't know exactly the vector here. The author is saying that these depictions in movies and TV of therapists breaking confidentiality is either contributing to the eroding of our notion of confidentiality as a profession and maybe as a society.
Yeah, right.
You know? Or it's a manifestation of the erosion that's happened over time.
Yeah.
And I actually, it does alarm me sometimes when I talk to novice therapists and they seem to not understand that they need to be baseline assuming confidentiality and only break that under very careful, very specific circumstances.
Yeah.
You know, it seems like right away they'll be like, well, of course I report it. Or aren't you supposed to report stuff like that? And it's like never enters their mind like confidentiality first, you know? So anyway.
That's scary that that's the case.
Another article here, 13 things mentally strong women do, according to a psychotherapist and best-selling author, written by Amy Morin on CNBC Make It. 13 things. They don't compare themselves to other people. What do you think about that one?
I don't like the basis so far of this article that I'm
Why?
hearing. Because is it I don't know, man. I don't know. That's like she's got this agenda or something. I don't know. There's something about, I can't articulate it, but there's something about this that's making me uncomfortable.
Yeah, well, let's go through them and see if you can articulate it. Number 2, they don't insist on perfection. Number 3, so these are qualities of mentally strong women.
Okay.
3, they don't see vulnerability as a weakness. Number 4, they don't let self-doubt stop them from reaching their goals. Number 5, they don't overthink everything. So is any articulation emerging for you?
These sound like, well, first off, I don't like things that are stated in the negative.
Okay.
I like things stated in the positive. And these also
I
sound
remember
like,
that note from when I would give you my book to edit. You would say, just state the statement. Don't, like be more direct, less passive, more.
Oh yeah, I don't like passive voice. Yeah. Plus you had a lot of very good things to say in your book and
worded badly.
Well, I'm a pretty good editor.
Could be better worded.
Yeah. So, there you go. And so far, the first 5 are sounding like sound advice for humans.
Right. That was what I took from it. I'm
Okay.
like, 13 things mentally strong women don't do according to psychotherapists. I mean, these are just things that are good advice for everyone. Like it's not particularly women based because part of the implication here is that men don't compare themselves to other people as much as women do.
Everybody does.
Right. It's a stereotype that men don't care. But
we are islands.
My God.
Yeah. But maybe this article is written for women because there's a recognition. Maybe there's a recognition that there's a power differential between men. There's a sexist power differential, and it might be useful to write things that validate the experience of women so that they don't undermine themselves. That said,
certainly,
she ain't saying anything that's not universally true so far.
Right. And I don't have a problem with it. It's just like, I'm just trying to think if there was an article like this, like, 13 things that Asian Americans do that are good for them or something.
Oh, wow.
It's just like, okay, fine.
Yeah.
But it's like, what's particular to women about these things?
Right.
The other thing is that it's easier said than done.
Oh, that's a great point.
Right.
That's a great point.
Right.
Just because you said I shouldn't be a perfectionist, it doesn't mean I'm going to stop.
Right.
Hey, man, if facts and logic did it, it would have did it.
I mean, I guess it's the purpose of the article, like the perfectionist thing.
Yeah.
And number 2, they don't insist on perfection. Although saying I'm a bit of a perfectionist may feel like a badge of honor, true perfectionism will hold you back. Establish high expectations for yourself while also accepting that mistakes are part of the learning process. So it's not bad advice,
No.
but it's a bit simplistic just to say like, just change your mind. Anyway, I won't go through the rest.
Just stop procrastinating. Yeah, that's good. That's a good idea.
Article Psychology Today here, written by David Ludden, PhD. How to stay on task during conflicts with your mate. A pretty long article here, but he starts by kind of hacking on cognitive therapists here, which I wanted to hear what your thoughts are.
Oh boy.
For the last few decades, cognitive therapists have been teaching their clients to regulate their emotions during conflict in a couple of ways. One approach is emotionally distancing, in which you attempt to step outside yourself, to acknowledge your emotions are there, but to observe them as an outsider rather than experiencing them in their full force. It takes some practice, but it is possible to distance yourself from your experience in the moment, almost as if you were outside of your body, in a process psychologists call dissociation.
What?
Yeah.
Where did this guy go to school?
Yeah. I'm glad you had the same reaction that I did.
Oh my God, it's outrageous.
Yeah, why is this outrageous?
Well, first off, I don't think cognitive therapists encourage dissociation. I don't think any good therapist can encourage dissociation. That's nuts.
Right. Well, let's drill down on that one.
All right.
One, you can't prescribe dissociation.
Yeah.
Dissociation is something you acquire or retain from childhood trauma.
Or actually, all people dissociate.
Mildly.
Yeah, mildly.
But we wouldn't use that term.
No, hell no.
Dissociation is a bad thing.
Yeah.
It's actually, in this context, something that really causes a lot of distress for people. So we wouldn't call it dissociation. If anything, we would just call it like trying to observe your emotions.
Yeah. Observe your emotions. Step back within, not without.
Yeah.
Yeah. So first off, the assertion that therapists do this is disturbing.
Right. And also, so he goes on with basically the thesis of his article is that mindfulness is the way to go. And there's research looking into that, how to mindfully be aware of your emotions, accept them, let them come, observe them, let them go, let them pass through you.
Yeah, right.
Don't fight it. Also, don't hand yourself over to it, which essentially is what cognitive therapists are doing, depending on the delivery that a cognitive therapist would deliver.
Presuming competent.
What?
Presuming it's competent delivery, they're going to coach.
Yeah.
Yeah.
There's plenty of cognitive therapists that I would imagine if you just looked at them and watched them, work with someone, they might look like they're actually talking about mindfulness, even though they wouldn't frame it that way.
They may not say those words, yeah.
Right. Now, there's plenty of cognitive therapists that are not competent at sort of knowing the nuance of these kinds of things and treat things like it's a choice. Like just, okay, you come home and your husband is, being very distant and you ask him for, you're trying to talk with him about chores, and he hasn't done any chores in the house for many months, and he's just playing video games all day, and your kids are running around, and you go to your room and you cry.
Yeah.
Well, just distance yourself from your emotions.
Oh, God, what an awful idea.
Yeah. Like, if you're sort of hardcore incompetent cognitive therapist, someone who's sort of unaware of the context or something, then yeah, that technique can actually be quite bad. But if you're talking about like, you're having an argument, or in that situation,
sure.
That I described, it's like, okay, well, observe your emotion, because you observe a pattern in this person who has, a distant, irresponsible husband and kids running around, and she has a lot of responsibilities.
Yeah.
She goes to her room, she cries. You realize as a therapist, there's a pattern where she basically just stays in her room for long periods of time, and is demoralized and then feels shameful about it and all this kind of stuff.
Right.
And so you could imagine having a technique with her. There would be lots of different techniques, including like how to assert herself. But if you're just looking on the emotional side, you could imagine saying like, well, so when you go into your room, I hear from you, you wish you could be more productive at night, at the very least spending time with your kids. What if you just observed the emotion as it is sad, because it is sad.
Yeah.
It's a real, anyone in your position would be sad and frustrated. So that's real, that's happening. Sure. But at the same time, just sort of experience it, let it happen. Don't indulge in it. Don't dive into it, just naturally let the sadness happen. Mm-hmm. And then just see maybe if it lasts for a shorter amount of time, Don't fight it, maybe call someone, I don't know. This is really sounding horrible as I'm talking about it.
Well, actually, no, I'm with you. And then I'm thinking, well, what something might be going along with sadness here is perhaps a great deal of shame, because there's a hiding of this sadness from, family, people that presumably love and care for us, right? A husband who may not be attentive in the way that, anybody would want. Maybe got problems, but I'm hiding from my partner. I'm hiding in the bedroom. I'm hiding my sadness. So maybe I could observe the impulse to hide, the impulse to go into my room. Maybe I want to disobey that impulse by staying still or by staying out and where the public spaces are. And it's going to come on me. I'm probably going to feel worse before I feel better, if I feel better. But there might be, would I be thinking about the utility of disobeying the impulse of shame? I could see that. And I love mindfulness, but that's really what that is.
Right.
Yeah.
Yeah. Do you find that people who talk about mindfulness that are super into it annoy you?
Well, it's the current buzz in our field is mindfulness. So yeah.
But have you ever, so I'm saying I have.
Oh, wait. People that talk about mindfulness?
No. Well, people who are like, so let me give you an example of what annoys me. They will, we'll be talking about, I don't know, something clinical, or I don't know, maybe even not. And they'll just be like, so do you do mindfulness? Uh-huh. Or do you use mindfulness with your clients? And I'll be like, I like it, but no, I don't usually use it. Oh my God. Evidence shows that it is powerful, and then they'll explain mindfulness to me, and I'll just be like, yeah, okay. Like I do a lot of things in therapy, and I totally get that mindfulness works, but there's just a certain sort of enthusiasm of like, it's the only thing that you should be doing or something. Have you experienced that before?
Oh yeah, but not just in the field of, counselors who are learning something. Like a lot of people do this, and certainly I have had my sophomoric moments where I've been soapboxing, and soapboxing is fucking annoying. Yeah. So, but one of the things I've noticed about mindfulness is it's a very easy thing and an interesting thing to talk about that has nothing to do with the actual practice of it.
Oh, what do you mean?
Like, people can talk about their mindfulness practice or talk about the importance of mindfulness and not be doing it, like actually practicing mindfulness. Practicing mindfulness is actually quite challenging and really provocative.
What do you mean? Why?
Well, I'll just speak for myself as an example. When I slow down, when I'm still, one of the things that emerges for me is a great deal of anxiety and a great deal of shame. So when I'm still, those things come forth for me. If I get still, I notice them, in pretty much any aspect of my life that I could imagine.
Those are the thoughts that pop into your head.
Those kind of feelings emerge, and
I
the
said
thoughts that go
something
with it.
stupid.
Yeah. Oh, yeah.
Why did I do that?
Oh, yeah. Sometimes really old stuff, like cringing at stuff I did years ago.
No one loves me.
Well, occasionally that sort of thing. Yeah. Yeah.
I'm alone.
Yeah.
Why aren't my relationships stronger or something? Okay.
Right. And so talking about mindfulness as a really important skill is, sure. And then doing it,
Right. Yeah, it's funny. There's been people that I can totally think of years ago who were like this, and I knew for a fact they didn't actually do mindfulness themselves.
God, was I one of them?
No.
Oh, thank God.
No, you've never been one of those people. And if you were, I'd lie to you right now.
God
Just joking.
bless you.
No, it wasn't you. It wasn't you. It actually happens rarely. I'm just like, I guess now when I think about it, it's like, mindfulness is one of those things that a lot of people talk about, but very, very rarely is it actually done.
Yeah.
As you're saying. But I also find that everyone knows about it, but like only a select few of people are really into it, you know?
Oh, yeah. Right.
I mean, I actually have a friend of mine who, Deborah Hatton, do you remember her? She bought Mary Hamilton, her business.
That vague memory.
Working Choices.
Yeah.
And she, at least years ago, used a lot of mindfulness in her practice, but she was totally not annoying about it. And didn't preach about it.
Proselytize. Yeah. Thank God.
Anyway, one more article here by Jean Marbella from the Baltimore Sun. Psychotherapist seeks to overturn Maryland's ban on conversion therapy.
Whoa.
A psychotherapist filed a federal lawsuit seeking to overturn Maryland's ban on treating minors with conversion therapy, which is a controversial practice that attempts to change clients' sexual orientation. So just chiming in here, it's not a controversial practice.
It's not controversial.
Yeah, to say controversial implies there's a controversy. There's not a controversy.
No.
It's vast consensus that conversion therapy is horrible. You don't say there's a current controversy that smoking causes bad problems with your health.
Yeah.
That's not a controversy.
It's not a controversy. There are people who deny it.
Yeah.
And will say,
That doesn't-
this is controversial because I have a different opinion. That does not make it so.
That does not make it a controversy.
Yeah.
That makes it, there's motivated reasoning among a certain group of people.
Hey, I've been stubborn before.
Yeah. Controversy. Christopher Doyle sued Governor Larry Hogan and State Attorney General Brian Frosh in U.S. District Court in Maryland, saying the ban violated his rights to free speech and the practice of religion and the rights of clients to prioritize their religious and moral values above unwanted same-sex sexual attractions, behaviors, or identities. What do you think about this, Bob?
That is a false statement.
Tell me more.
Read it again, because there's some things that stuck out.
The ban violates his rights to free speech and the practice of religion and the rights of clients to prioritize their religious and moral values above unwanted same-sex sexual attractions, behaviors, or identities.
No, no, that's not true. What's going on here is not religion. It's clinical practice. That is not religion. That's that sure is overlaying something really important. And
right. So to be clear, and this is the argument of those who will ban it, is that you're free to practice your religion.
Yeah, go for it.
But if your religion interferes with evidence and clinical practice and ethics, then we have a problem.
We have a big problem.
So if a physician has a religion, like say that for whatever reason there's a physician who's a Christian Scientist.
Sure.
That's probably happened at some point. And every patient that comes to them, they're like, just go home and pray.
Yeah.
God will save you. That's not okay. Like you're free to be a Christian Scientist.
Yeah, go for it. But you're not practicing a religion at that point. You're practicing medicine.
Right.
And that is different.
Right. And if you're a consumer and you want to not go to the doctor because you have an illness, then you can practice your religion in that way. But if you're a physician, as endorsed by licensing boards and professional organizations, then you have a duty to uphold the professionalism and the evidence thereof.
Yeah.
Right? And so we have decided, and through massive amounts of research and discussion, that conversion therapy is harmful to people.
Yeah.
One, because outcomes show that people enter those things and come out with in general much more symptoms of suicide, of depression, anxiety,
shame.
2, it doesn't work.
It doesn't work.
It doesn't make you not gay.
It does not.
Yeah. Or not trans or something.
Yeah.
So, the evidence shows like it's in the same way that a physician can't use leeches to bleed you.
Actually.
Or unless there's a legitimate reason for it, right? But say you have depression and,
Lord, yeah.
Or cancer, and they use, them to bleed you, then, you can't do that. And you can pass laws that, the only reason why they pass these laws is because it's being practiced. Like, it shouldn't be practiced in the first place. We don't have a lot of laws. There's not a law in Washington State that says you must treat your clients with respect, right?
Yeah.
There's no law like that because most therapists agree and understand that that's what you're supposed to do.
Sure. We don't have laws for a lot of things.
But there's a problem in our society, and you have a minority, a very small minority of therapists who consider it totally legitimate practice to do conversion therapy. And so it's like, we got to put an end to that. We got to pass a law. Anyway.
Yeah.
Anything more to say about that depressing topic?
That is depressing. There was something, but it flew out of my head, so.
Sorry.
No, nothing to be sorry about. This one sucks.
Yeah. Very similar case here. Psychotherapist sues New York City. So last one was Maryland.
Yeah.
This therapist is suing New York City for prohibiting gay conversion therapy.
Oh.
On Wednesday, a devoutly Orthodox Jewish psychotherapist who is represented by the Alliance Defending Freedom filed a federal lawsuit against the city of New York over its new ordinance preventing therapists from treating patients who want to follow their religious faith and rid themselves of unwanted sexual desires, such as same-sex attractions, or gender dysphoria. They note, notably, the law only prohibits counsel in one direction, assisting a patient who desires to reduce same-sex attraction or achieve comfort in gender identity that matches his or her physical body. By contrast, counseling that steers a patient toward gender identity different than his or her physical body is permitted. So just commenting on that, what do you think, Bob?
Well, there's something about it that's disturbing that I can't quite get my fingers on.
Well, maybe it's this. No therapist counsels someone to be gay.
Right.
No therapist counsels someone to be trans.
Right.
You're only counseling someone as they are emerging from their own trans identity or gay identity.
Right.
Or you're helping them to accept the fact that they are gay or trans.
Yeah.
So this implies like therapists are there's, in this direction, we're pushing people. And so therefore other people should be allowed to push them back.
Right.
There's just so many things wrong with the thing.
Well, how would it be different? Because it would be, for folks that have pedophilic sexual orientation, isn't that? I don't know if I'm saying it the way that it's talked about.
Where did you say?
Pedophilic sexual orientation.
Mm-hmm.
Yeah. So, what's treatment for them look like? Because it's probably not about. It's about not acting on behavior, but the difference is that the behavior of a pedophile is harmful to somebody else, whereas if you're gay,
right,
nobody getting hurt.
Right, exactly. So the thing here is that we have a society that teaches people that there's something wrong with them when there isn't something wrong with them.
Right.
And so then they go to therapy to fix something that they think is wrong with them when there isn't anything wrong with them.
Right.
And that's a problem. Imagine if we as a society taught that to want to have long hair or something,
right,
or to like to have tattoos or something is somehow pathological,
right,
and you're going to go to hell. And you want to grow your hair out, but it's just, and so you end up going to therapy so you can avoid growing your hair out.
Yeah.
We would say to that, like, well, there's nothing wrong with growing your hair out. Like that's the problem. We don't need to fix people who want to have their hair long. We need to fix society. We need to stop. Let's just stop doing this and let's try to fix society so no one comes to our office in the first place.
That's a clear identification of where the problem is. And the problem here is homophobia.
Right.
Not I'm gay.
Right. And I'm really, and I have a hard time about it. You know
Right.
what I mean? But it is kind of interesting because, you know, I've talked about this before, but I essentially did conversion therapy without knowing it many years ago.
You did?
Well, I had a client who came, you know, early, way before I started being a therapist.
Sure.
I shed all conscious homophobia and heterosexism that I could, you know what I mean? It was, so that was not a problem. But I had a client come to me about 10 years into my career who was gay, and he was married with kids, and he said that he didn't want to have gay impulses or behavior anymore. Because, and so I said, well, that's interesting. Why? He's like, well, I'm married. I love my family. I love my kids, and I love my wife, and I don't want to divorce. You know, I don't want to lose that life. And at first I'm like, well, maybe you can have everything, you know, you can have your cake and eat it too. I mean, maybe you could be gay and maybe eventually have a relationship, a long-term relationship with a male or not, whatever, but get that need met. And also have a relationship with your wife. Maybe she's an ex-wife, I don't know. And you parent your kids together. Like there's a way to do that. And so, you know, we'd go round and round and round on that. But eventually, after months of this, he's just like, no, I need you to help me to not, because I'm starting to have impulses to cheat on my wife. You know what I mean? I'm starting to have all these impulses to go outside of my marriage and have sex with men. And I don't want to do that. I want to stay in my marriage. I like having sex with my wife. I'm okay with it. I'd much rather have sex with men, but I'm okay having sex with her and blah, blah. And, you know, it was very uncomfortable to me because you could see the conundrum, right?
Yeah.
You could, you know, especially if for whatever reason he can't accept or doesn't want to go down a path of divorce and all that kind of stuff.
Yeah. I could understand not wanting to have a divorce and, you know, have that massive change in life.
Right.
Sure.
Right. And so he asked me to help him to have less impulse to have sex with men.
How'd it go?
I forget, honestly. It was a long time ago.
Long time ago, yeah.
I don't think it worked.
Yeah,
you know?
I imagine it did not.
I mean, what it came down to was, I think what I landed on, if I remember right, was, look, I think you have to accept the fact that you're attracted to men.
Yeah.
Like, I don't think that's something that is worth or, you know, gonna work fighting against. So let's just accept that. But obviously you can control what you do with your body, you know, and who you have sex with. Like, that's something you can choose to do if you really want to. Because that was that whole other conversation. It was like, well, what do you really want out of this? You know, are you denying a part of yourself? Do you have internalized homophobia that's sort of routing you in a particular way? And so it was a very complicated conversation. And my point is like when we talk about conversion therapy, the classic examples are horrible, like where kids are forced into conversion therapy camps by their parents or something. Right. That's horrible. Or you have a trans person that lives in a very transphobic community and they just feel so shameful and awful about themselves. And then they, you know, in their community, there's a conversion therapist and they go to that person.
Sure.
These are horrible situations. But there are nuanced situations where it gets a little harder to figure out what's happening and whether or not it even is conversion therapy. You know?
Well, you're not describing conversion therapy. You're describing accepting, okay, you're going to be attracted to men. I think conversion therapists try to shift a person's, you know, who they're attracted to. Don't they?
Right. The idea is that you can, like a pedophile, you can sort of break someone of their orientation and change it. You know what I mean?
I don't think you can break a pedophile.
There's not a lot of research on that, and I forget the research.
Yeah.
But I think you can actually, for some people, you can actually alter or expand their horizons a little bit.
Expand their sexual orientation to include
people their own age.
People their own age.
Yeah. I can't remember the details on that, but plus some people are attracted to kids because of quote unquote an orientation, meaning it's just sort of like in their bones, so to speak, which is of course impossible to prove, but it seems that way.
Yeah.
And other people are attracted to kids because of other reasons, like they don't feel their maturity they don't feel like they feel their maturity level is kids. Like they feel like a child.
Yeah.
Like Michael Jackson might have been someone like that.
Yeah, maybe. Yeah.
Like he might have actually, because the way he talked like and acted like he was a child.
Yeah.
And he might have actually felt like other kids were his peer.
Yeah.
You know, and to have sex with an adult might have felt really weird to him. It's complete speculation.
Yeah,
of
yeah,
course.
it's speculation because kids aren't really engaging in. Well, I mean, sexual experimentation, but it's usually there's a difference in kids' sexual experimentation and an adult's body and the way it responds. It's really not the same.
But if you consider yourself a 10-year-old,
I get it.
Then you're going to, I don't know, and you have a man's body and a man's like hormones or whatever. Anyway,
that shit scares the hell out of me, man.
Yeah. Last one here. Business Insider writes here, there's a psychotherapist, Jonathan Alpert, writes about how he thinks therapy is kind of bullshit.
Oh.
So he's a therapist himself.
Oh.
Many patients attend therapy for longer than they need, he says. What do you think about that one?
Well, how do you define longer than you need?
Right. But have you heard this sentiment before by like CBT people and other brief therapist people? Do you hear this?
Yes, of course.
Yeah.
Yeah.
They'll just be like, oh, people are addicted to therapy.
Yeah, like what is that?
Yeah. They'll accuse therapists essentially of like, you know, for self-serving reasons, like keeping people in therapy.
Well, no, actually, I think there's something to that.
Sure.
Humans are just set up to serve themselves.
Right.
And so when you engage somebody as a client, when you take on a client, you do indeed take on something that's reinforcing for you.
Right.
So, you know, I think actually it is a dilemma that if you're wise, you know, you keep your eyes on.
Yeah. As a therapist, you keep your eyes on the countertransference or the self-serving urge that you might want to keep someone in therapy longer than they need to be. But often what I find that these accusations are based on is this notion that, you know, they're into their brief form of therapy, you know, which is great.
They like what they like.
Yeah.
Yeah.
And they attract a certain kind of client who is interested in brief therapy.
Yeah. Right.
I, as a long-term therapist, tend to get people who are really interested in tackling things that require long periods of time.
Yeah.
You know, you experienced a whole lifetime of trauma, particularly early in life, of relational traumas, and you don't really know who you are, and you're not really connected with yourself.
Yeah.
You don't value yourself. You're very confused by your emotions day in and day out.
Yeah.
You're very confused about your impulses and your trust issues, and you've created a life where you're quite upset, you're quite emotionally reactive, or too independent, or too dependent.
Yeah.
And it's been 40 years of that. And, you know, 5 sessions ain't going to do anything to that. I mean, I can teach you a little bit, you know,
sure,
some emotional regulation skills.
Yeah.
But sifting through all those things, and plus there's, you know, with my couples, for example, all the couples, I can't remember the last couple that terminated. Well, no, I had a couple terminate with me a few months ago saying that all they needed was 5 or 10 sessions, and it actually had sort of set them on a good direction. They didn't need help anymore.
Oh, yeah, great.
But a lot of the couples that I see like once a month because they need that space to have that conversation and to do incremental adjustments, incremental changes as they go through life. And if they don't come to therapy for a few months, they'll kind of drift back to old patterns.
Yeah.
And so what this Jonathan Alpert is saying is just like, apparently that's not valid or something, you know?
Well, he has a confirmation bias.
Right.
Yeah.
He also writes,
probably
when therapists let their parents vent, when therapists let their patients vent about their problems for a long time, it can leave the patient feeling better, but it won't lead to meaningful changes in behavior. What do you think about that one?
Yeah, I don't like the term vent.
Why?
What I've been thinking.
Why don't you like the word vent?
I think it's dismissive.
Interesting.
I think.
Yeah, I would agree.
Yeah. Let's see. I want to put this clearly because this has actually been something I've been thinking about very carefully for about the last year, and in particular the last 3 months, which is when people come in, sometimes they are locked into either addressing something, you know, as if therapy is a task, or they're invested in a narrative. And there's something. So I think of that as content, right? And what I focus on these days is process. What's the process of you and me sitting together and having this conversation? So recently, somebody came in and they were telling me a very detailed story about something in their job. Their job is something that is very idiosyncratic, and so their experience of it is not relatable to, people who don't do that kind of work, right? And the story was very detailed, and I'm sitting and I'm listening and I'm thinking, what's going on between us right now? And I wouldn't call what she was doing was venting, but we talked about the impulse to share the narrative in great detail. She was recognizing that that's actually something that she does. And we started talking about, what are you hoping for? What is it that you're wanting here? And we hit on something that was so tender and really just so touching. She said something like she's not allowed to be proud of herself. And she's not allowed to talk about it. But the facts are she is proud, and she wanted us to appreciate her good effort, this thing that she does that's really mind-blowing. It really is mind-blowing what she has learned to do. And we ended up talking not a bit about the actual work event and about that longing and desire that's within her. Now, if you want to call getting lost in the content venting, okay, I don't like that term. And if you want to think about, if he's talking about, well, what's the process of the thing happening, then yeah, I agree with what he's saying. I don't like the way he's saying it. Because I think that there is value in that. I've experienced that personally and also professionally.
Yeah, it's a beautiful story.
Thanks.
I think what he's referring to, based on the gestalt of his message, is that so the next one should light on it. Instead, he said therapists should use their time to push patients to reach their goals. So essentially, his form of therapy, which isn't invalid, is that, or unvalid, not valid?
No, invalid, yeah.
Is that his style of therapy is people come in and he's like, what do you want to work on? What do you want to change? What do you want to do? And then they work on that. And if the client starts to vent, he's like, well, wait a second, let's bring it back to what you're here to do. Let's focus on the task at hand. Does it help to do that? Or does it help to really focus on your goals and figure out what you want to do? I'm going to hold you to what you want to do. Maybe that works for people.
Maybe. Sounds abrasive.
But and maybe people dig that kind of therapy. But a lot of people, if I did that with my clients that I'm seeing right now, it just wouldn't work. I'm just here to tell you.
Oh my God, no.
And I find that these sentiments are everywhere in our society. You know, it's just like people are addicted to therapy and venting doesn't help. And I'm like, yes, it does.
Yeah.
Like complaining about things that are bothering you in life is a wonderfully curative, helpful thing. When you are, when someone flips you off on the freeway because you didn't do anything wrong and you come home and you complain to your spouse about that. And you're like, I can't believe that asshole on the road. And your spouse is like, oh my God, I can't believe that asshole. I'm so sorry. Let's hug. That is a wonderful, stabilizing, validating, encouraging thing that will balance you out and put you on your day. If you don't complain and it festers inside of you, then that's bad. And you just pile up all the shitty things that happen in people's lives. And sometimes people have a lot of things they have to get off their chest. Well, that does it for that episode of Psychology in Seattle. Thanks for joining us out there. Please take care of yourself because
you deserve it.